Hello everyone. Welcome back to Sustainable Living with Shilpa Reddy, powered by Planet Greens Farm Natura, a new beginning to your life. Sustenance of women's health is extremely important for the family, for the community, and for the nation. Breast cancer is rising concern among women of all age groups and is getting more common among the young in our country. Don't we all know at least one person who's been affected by cancer? October is the month of breast cancer awareness, and today's special episode on sustainable living with Shilpa Reddy is to create awareness and bust all the myths to sustain breast health. I am honored to have one of the youngest doctors to have received the Padma Shri Award. He is the founder and director of Usha Lakshmi Breast Cancer Foundation, KIMS Hyderabad. Dr. P. Raghu Ram Garu, who is on my show today. Thank you for coming on my show, Raghu Garu.
Thank you, Andy. Thanks for inviting me.
Pleasure is mine. I've known you for so many years and you've relocated, I think 15 years it's been.
Yes.
And my first question is, have you seen any kind of attitudinal change when it comes to breast cancer in our country?
Yes, indeed. I think it's exactly 15 years. October 2007, I relocated to India, and it's been precisely 15 years. And we launched the Pink Ribbon campaign in 2007, October. My mother had breast cancer, so that's what brought me back to India.
Right.
And we launched this Pink Ribbon campaign through the Usha Lakshmi Breast Cancer Foundation. And over the past 15 years, we've been working relentlessly to create the importance of early detection through a number of initiatives. Because in our country, breast cancer is a taboo. It's a closet issue. It's an issue that is hushed up. Even in urban India.
Okay.
So in many parts of particularly rural India, where 70% of our population reside, it's certainly a taboo. In urban India, particularly in Telangana and Andhra Pradesh, we've been able to break that taboo and create that much needed awareness that people should talk about it. We have made it a much commonly discussed issue. Previously, it was all hushed up.
Absolutely.
So what's very gratifying is that, I've been seeing several individuals, organizations, institutions, hospitals taking inspiration from this Pink Ribbon campaign and conducting a number of initiatives. For example, a walk for an illness was unheard of in the past. Now, almost every other week, we find that people are doing something for various ailments, not just breast cancer.
That's true.
So I think it is really gratifying that the Pink Ribbon campaign has enthused and inspired people to take up similar campaigns, which I'm sure will go a long way in touching many lives and saving many lives.
So now let's talk about the basic questions that everybody has about breast cancer, Raghu Garu. So what causes breast cancer is my first question, and why is it on a rise? Initially I would see people above 35 getting it, but now I see at least I hear a lot of younger people also affected by breast cancer. Why is it on a rise and what causes it?
So any factor that increases the exposure of the hormone estrogen for a prolonged period of time on the breast can potentially cause breast cancer.
Okay.
So there are several risk factors. For example, early menarche, late menopause, not having children, and having the first child after 30, not breastfeeding, sedentary lifestyle, obesity, particularly after menopause, and excessive alcohol consumption, smoking. So there are several factors that cause the increased exposure of the hormone estrogen. In addition to this, family history, not just my mother having breast cancer and my children are at an increased risk. That's not true. So significant family history, we call it strong family history. That is, in the immediate family, if someone's mother, sister, grandmother has been diagnosed with breast cancer under the age of 40, or there are 2 or more breast cancers diagnosed in the immediate family, or there is a history of breast cancer and ovarian cancer in the immediate family, or male breast cancer in the immediate family, such people are at an increased risk of developing breast cancer through an abnormality of BRCA1 and BRCA2 genes. And it's not necessary that whatever I have just mentioned, these risk factors definitely mean that they have an abnormal gene. But when such a strong family history is there, that accounts to about 5 to 10% of breast cancers.
Okay.
So these are the few risk factors that can potentially cause breast cancer. But I must say that breast cancer is a tsunami. World over, since the year 2020, it
Okay.
has even overtaken lung cancer
Oh, are you serious?
to become the commonest cancer affecting women. So
Okay.
this is the commonest cancer. If you take all cancers combined, breast cancer has overtaken all the cancers.
Really?
And in India,
Okay.
it is the commonest cancer. It has overtaken cervical cancer. It is the commonest cancer. We see about, on an average, 200,000 new cases of breast cancer every year. Every 4 minutes, someone somewhere in the country is diagnosed with breast cancer.
Well, these statistics are quite alarming.
It is alarming, and this is only the tip of the iceberg because we don't have a robust cancer registry where all the cancers get registered. So this is just the tip of the iceberg, and every 8 minutes, someone somewhere dies of breast cancer. Nearly 90,000 women succumb to breast cancer in our country, and for every 2 women diagnosed with breast cancer, 1 woman dies of it. That is because of lack of awareness and absence of screening program, because of which more than 60% of breast cancer is present in the advanced stages. So there is so much of work to be done in terms of advocacy, in terms of early detection. And our country in India, compared to the West, where we see a lot of breast cancers after the age of 50, in India, the peak incidence of breast cancer is from 40 to 50. And the reason is, we are a young nation.
Yes.
About 87% of our population is under the age of 50 years.
Correct.
So only 13% of our population is over 50 years. So therefore, since we are a young nation, we have a lot of young people, and therefore that's probably why we are seeing a lot of breast cancers in young women.
Okay.
And the challenges faced by young women with breast cancer is significantly different from those faced by older women.
Can you state a few?
Well, first of all, it's an agonizing experience for someone who is young, who would never ever imagine that they would get breast cancer at that age.
Right.
When they are diagnosed with breast cancer, they are in a state of shock.
Correct.
So that is the first thing, and that is one of the reasons why there is a delay in diagnosis. They do notice a lump, but they would think, I'm young, there's no way it will be a cancer. So they ignore that lump for some time, by which time it would be advanced.
Correct.
So therefore, because they are young and they don't expect that they would be getting breast cancer, when they delay that diagnosis, that is the first challenge.
Okay.
The second challenge is in young women, breast imaging, that is mammography, is quite difficult to interpret. The reason is a cancer appears white. The breast tissue in young women, there's a lot of dense breast tissue. So essentially, breast has got fat and breast tissue. The breast tissue on a mammogram appears whitish, and the cancer also appears whitish. So as women age over the age of 50 years after menopause, this breast tissue content comes down, this whitish content which we see on mammogram, and the dark content, which is the fat content, increases. So therefore, it's easier to pick up breast cancer in older women.
Okay.
So when someone is young, there is a challenge to pick up breast cancer on mammography. So there are issues relating to diagnosis. And the third is, which is very important, managing breast cancer in the young is not easy because sometimes the treatments don't work.
Really?
Many times they recur, and the prognosis is poorer in younger women.
Is it also true that it also advances very fast?
Yes, so it rapidly progresses because the presentation also is late because of the reasons I've just mentioned. So women ignore symptoms, so they present late as well. In addition to this, they have got huge challenges because they are young, they would have a young family, there are fertility issues, so and then many of them will need chemotherapy where there is hair loss, which causes again a lot of agony. So therefore, managing a young patient would be very difficult is just an understatement, because it is a huge challenge.
What are the symptoms and what are the first things a woman would detect if she's suspecting breast cancer?
Yeah. So the first and foremost thing is there's a fine line between advocacy and scaring people. So we are here to create that awareness.
Yes.
So majority of women who have any breast health issue, they are benign. They're not cancerous.
Okay, great.
But when someone notices a painless lump in the breast, recent indrawing of the nipple, or blood stain discharge from the nipple, or recent excoriation of the skin around the nipple areolar region, or dimpling of the skin overlying the breast, they shouldn't ignore.
So those are the initial things that you notice?
They are not the initial. These are symptoms. When they notice these symptoms, because women must be encouraged to look and feel how their breasts feel throughout the month. It's not just at one particular time, as is advocated through breast self-examination. So if there are any new changes like a painless lump or recent excoriation around the nipple areolar region, or indrawing of the nipple, or blood stain discharge from the nipple, they shouldn't ignore. They must report to a doctor. So that is very, very important for women to be aware of any new changes. A young woman or an older woman, any new changes must not be ignored.
Okay. What is triple assessment?
Right. When a lady notices any new change in the breast, they must go to a doctor, a specialist, who must do what's called triple assessment. Triple assessment is, first of all, talking to the patient, making the patient comfortable, taking a history and examination. That's the first component.
Okay.
The second component is breast imaging, which is a combination of mammography and ultrasound scan. Mammography is an X-ray of the breast.
Right.
And third component, if there is a lump in the breast, it needs to be biopsied. And there are two ways of doing a biopsy. One is a fine needle aspiration biopsy, which is called FNAC, which is largely given up because it is inaccurate and it leads to false positive diagnosis.
Okay.
So the gold standard is, under ultrasound guidance, a core needle biopsy, that is a tissue biopsy, is done, which accurately helps to distinguish whether the lesion is benign, that is non-cancerous, or cancerous. So by way of triple assessment, we're able to definitely tell without the lady going under the knife that this lesion is a cancer or not. And we're able to reassure the vast majority of people.
So that's like completely foolproof kind of
Absolutely.
assessment.
Of course, there are exceptions. Sometimes even with triple assessment, we can't make a diagnosis.
Really?
When we may have to take the patient to theatre and do an excision biopsy. But by and large, if someone is asked to go straight to theatre to get a diagnosis, they're in the wrong place.
Correct.
So triple assessment is now the gold standard.
Okay.
Yeah.
What role does counseling play in managing patients when they find out that they're affected with cancer?
So counseling is absolutely important. It's paramount. In my opinion, it's more than 50% of the treatment. Because once someone is diagnosed with breast cancer, it's just like a veil. Whatever the doctor is saying, the patient and the relatives are in a state of shock. They're not able to absorb.
Correct.
So it's important to patiently explain, not just once, but many times, in a simple, easy to understand format.
Okay.
Not using complicated jargon, and with empathy. And it's very important to give that much needed inner strength to that lady, because cancer doesn't just affect the body, it affects the body, mind and soul.
Correct.
So just treating the body will not help treating the cancer, because I've seen a lot of women who are in a state of depression, and whatever treatment is given, even if it's an early cancer, it doesn't work. Whereas women, even when they have a reasonably, locally advanced breast cancer, but they're very strong and they get that inner strength and they have the courage to fight, they really actually come out of cancer.
Right.
So counseling is the most important and the first component before any treatment is given.
And this is done by the doctor himself?
It should be done by the doctor. And in fact, in India, counseling was introduced into the medical curriculum just a few years ago.
Oh, really?
So counseling is not given that much importance, but I take it upon myself that when a patient comes without counseling, we have a dedicated counseling room as well. Without counseling, patients should not be taken up for treatment. That is the most important component of care. And it not only prepares the patient's mind, it also helps answers a lot of doubts, in addition to giving that much needed strength and courage to fight breast cancer.
Okay. So about mammogram, most of the women don't go because someone somewhere must have told them that it hurts. Does it hurt? And does it have any radiation hazards? And how often should a woman go for mammogram and from which age?
It's a very, very pertinent question, Shilpa Garu. So basically, mammography is an X-ray of the breast, and mammography causing a lot of people, as you rightly said, hesitate to go for screening mammogram because they think it's radiation hazard. Second is it's painful. So first of all, radiation hazard. It's not a radiation hazard because the radiation from a mammography is equivalent to a dental X-ray. So it's very, very tiny radiation. Minimal. So therefore, in this day and age of digital mammogram and 3D mammography, the radiation is even less. So women don't need to worry about the radiation hazard. So women 40 and over, from the age of 40, must get an annual screening mammogram. And the question about pain, yes, there's momentary discomfort because the breasts are compressed. But if the radiographer is trained well, radiographer is not a radiologist, radiographer is the one who does the mammography. So many a times women directly report to the mammography unit before they consult a doctor. So therefore, we train our radiographers to comfort the patient. So patients come very anxious, thinking they have cancer. So it's very important to comfort the patient and calm them down before they do the test. And even in doing the test, there are certain techniques that one can employ to minimize the discomfort. So if the radiographer is well trained and also trained in counseling patients and in comforting patients, certainly it won't be painful, except for a momentary discomfort.
I can say that because I get it done every year and then there's barely any discomfort. So if that helps people to hear it from my side, I would say the same thing. Raghu Garu, is it true that men can also get breast cancer?
Yes, it is true. 1% of breast cancers occur in men. So if 100 people are diagnosed with breast cancer, 99 will be in women and 1 will be in men, because men also have breast tissue. It's not uncommon, it is rare, but even men, if they notice any new changes, as we just discussed, they must go to a specialist. But not to be too alarmed, but any new changes.
Just to be cautious and see if there's any changes that happen.
And because men have got less breast tissue, and if it is ignored, it can spread faster and present in an advanced stage. So therefore, they must be also vigilant. Because we do see, in India, we don't have precise statistics, but overall, world over, it is about 1%.
And is it also true that women who use contraceptive pills for a long time, do they also have a risk of getting breast cancer?
The answer is no. Modern day birth control pills don't have high dose estrogen. So they don't predispose to breast cancer. But hormone replacement therapy, if it's given over a prolonged period of time with high doses of estrogen for over 10 years, that can predispose to breast cancer.
And who are the people who are given this therapy?
So people who require hormone replacement therapy, the gynecologist will take a call, but they must be cautious as to when they prescribe the hormone replacement therapy. It must be in such a way that they don't use it for a prolonged period of time and it doesn't contain high doses of estrogen.
So Raghu Garu, most of the women fear that if you, get breast cancer, your breasts have to be removed, like mastectomy is what they say. So, but is there anything that, in today's day and age wherein they can preserve their breast?
Indeed. A lot of women, in India, particularly in India, the mastectomy rate for breast cancer is phenomenally high, more than 80%.
Really?
Whereas in the West, it's the reverse. So I think it's very important to understand that whilst a few women with breast cancer will need mastectomy for various reasons, but a substantial number of women can also undergo breast conserving surgery. In this day and age, cancer treatment is multimodality treatment. You have surgery, you have chemotherapy, you have radiotherapy, you have hormone therapy, and you've got targeted therapy. Now, when the cancer is large, when we call it locally advanced breast cancer, in this day and age, with the help of modern day chemotherapy regimens, we're able to downsize the tumor. That is, we can reduce a tumor which is even 5 centimeters to 2 centimeters or even less. So we give it upfront before doing the surgery. We are able to give the chemotherapy, downsize the cancer, and then offer such women also breast conserving surgery. So that means it's not just for early breast cancers that we can do breast conserving surgery. We can also do breast conserving surgery for those who present with locally advanced breast cancer after giving what is called neoadjuvant chemotherapy. And when someone's
So with this therapy, you first reduce the size of the tumor, so it's easy to preserve.
It is easier to preserve and remove less tissue. So if it was a big tumor, you got to remove a big chunk of tissue. When you remove a big chunk of tissue, there's going to be a big defect in the breast. So whatever lump is removed, there is bound to be some kind of cosmetic deformity. So in this day and age, over the past 20 years, there have been refinements in surgical care, and there is a concept what is called oncoplastic surgery, where the surgeon combines oncological principles with plastic surgical principles to remove the area, that is the breast lesion and a normal tissue around it. And when a defect forms, that defect can be covered by reshaping the breast through various techniques. So for example, if there is a lump in the upper inner quadrant of the breast, that is the bra line, any incision that is made there will be cosmetically not acceptable, and also because there is less breast tissue there, there's bound to be a defect. Now there are various techniques which can be employed to fill that defect and place the scar in such a way that it is cosmetically feasible and acceptable. So these techniques, I'm not talking about breast reconstruction after mastectomy, because that's a different thing. So when women have mastectomy, their breast mound can be recreated through reconstruction. I'm talking about reshaping the breast after removing the lump, which should be offered to women, because just removing the lump and leaving a big defect is not doing any good to that lady, because you're going to leave a big cosmetic defect which is going to see day in and day out. So there are a lot of refinements in breast cancer surgery, and more women are now suitable for undergoing breast conserving surgery.
So have you noticed any significant change among women who have gotten this oncoplasty and also getting their breast conserved or preserved?
Yes, many of patients who come to me who have been told that they would need a mastectomy, when after counseling, it's all giving options. Basically, it's very important not to be dogmatic and dictatorial. As a doctor, it's very important to give the patient the choices, if there are. Sometimes there may not be a choice, as I mentioned to you. Sometimes there may not be a choice to have breast conserving versus mastectomy. But when there is a possibility, if one is able to counsel the patient, then the patient will absorb whatever has been said and will be able to discuss with her spouse, and they will have questions, and those questions must be answered patiently. And many a times I have found, when these options are given, many choose to have breast conserving surgery. And what I tend to do is I also put them in touch with other patients who have had breast conserving surgery. So once they speak to them, they get a lot of confidence. So it's all in preparing the mind to direct
and
the
share
patient.
the knowledge.
So that they can take an informed decision. Rather than saying this or that.
So Raghu Garu, with all your experience, what are the 2 to 3 most important things that you would want to share with women, above 30, and to be cautious about breast cancer?
Right. It's a very good question, Shilpa Garu. So I think what I'd like to say is, this is the International Breast Cancer Awareness Month. I think this is a month to create awareness. And that's why we are here. Very grateful to you.
Pleasure is mine.
So I think women, first and foremost, is women of all ages must be breast aware. That is, if they notice any new changes, as we've just highlighted, they must not ignore, they must report to a specialist. Women of all ages, because as we again discussed, breast cancer can occur in younger women as well in India.
Yes.
So therefore, women of all ages must be breast aware. That's the first point. Second is, women 40 and over must get themselves an annual screening mammogram. So we are in a month of festivals. We just celebrated Deepavali and we had Dashara. So I think when we have festivals, it's a practice to buy saris and various other things. I think for the men watching this program, I think it's a message to them that for the women in their lives, whether it's their spouse, their mother, their grandmother, please gift a mammogram
Mammography.
on an annual basis. And October is the best month to do that because there is buzz around across the world.
Correct.
October is the breast cancer awareness month throughout the world. And I think that's the best month to gift a mammogram because many lives can be saved with that.
Absolutely.
And so I think that's the real message that I'd like to give. In addition to stating that once again that most breast health issues are benign, not to panic, to report to the specialist, and I'm sure majority will have their good health.
And any health care advice or the lifestyle advice that you would like to give?
Yeah, I think the third point which I'd like to say is breast cancer is preventable in certain way. It's not entirely preventable, but I think physical exercise, it's very important. You're a fitness enthusiast, so I don't need to be saying that to you, but I think the message is physical exercise, not having sedentary. You must get out of the sedentary habits and you must be moving at least 30 minutes of exercise, active exercise every day. Try to avoid being obese because after menopause particularly, the fat cells produce estrogen and that can potentially cause breast cancer. So avoiding obesity, avoiding sedentary habits and eating the right food, healthy diet is very important.
Home cooked food is what I tell people.
Absolutely. And also avoiding excess intake of alcohol and smoking. Now smoking also is now a risk factor for breast cancer. So we see a lot of young women smoking quite a lot. So I think it's very important that with these lifestyle changes, they will be able to minimize the risk of getting breast cancer.
So Raghu Garu, if someone is detected with breast cancer and treated, do they have a higher risk of getting it again?
Well, it's unpredictable. As we have discussed about the various risk factors, one of the risk factor is if someone has had previous surgery to the breast, whether it could be a wide local excision, that is breast conserving surgery, or a mastectomy, they have a higher chance of getting another breast cancer. It could be a new breast cancer in another breast, or it could be a recurrence. But with modern day treatments, and if cancer is detected early, we hope that women do not get recurrence. But yes, recurrence, it is a risk factor. It is a risk factor.
And one more question, do we need to remove all the lymph nodes when detected by breast cancer?
The answer is no. Just as in breast surgery, as I've explained, that increasingly more and more women are being suitable for breast conserving surgery and oncoplastic breast surgery rather than having a mastectomy. Similarly, in the axilla, because axilla is the armpit. When someone gets breast cancer, the first port of call for a cancer to go would be to the lymph nodes in the armpit. So traditionally, at the same time as breast surgery, that is whether it was a mastectomy or breast conserving surgery, the traditional practice has been to remove all the lymph nodes. That's called axillary node clearance. But with that, there are a lot of issues. Women get altered sensation in the inner aspect of the arm. Some people get shoulder stiffness. Some people get about 5 to 10% swelling of the arm, which is called lymphedema, which can be lifelong.
Oh my God.
So to avoid all these things, in the recent 20 years, there have been developments in refining the surgery to the armpit. And what is called sentinel node biopsy. Sentinel node is the first few lymph nodes that the cancer could potentially spread to. So when someone is having surgery, that is before surgery, what we do is we do an ultrasound scan as part of triple assessment. And if we find that there are no abnormal lymph nodes in the armpit,
Okay.
those women would be suitable for having sentinel node biopsy. And at the same time as doing surgery to the breast, we inject a dye near the nipple, which travels to the armpit, and we remove a few lymph nodes from the armpit and send it to the pathologist for examination whilst the lady is under the anesthesia.
Oh,
so that is
okay.
called frozen section,
Okay.
where the pathologist will cut open a lymph node and see whether there is any cancer in that lymph node. If there is cancer cells in the lymph nodes, then we remove the lymph nodes.
Okay.
Through the traditional axillary clearance. But if there isn't any cancer in the sentinel nodes, then we don't do anything further. So that way we are, preserving the function of the upper limb.
Okay.
We are avoiding altered sensation, shoulder stiffness, and most importantly, the most difficult lymphedema as well.
Okay.
So
this is the latest technical
This is not the latest, but this has been on for several years now.
Okay.
So just as oncoplastic breast surgery has evolved over the last 20 years, sentinel node biopsy has also been a routine practice now for the last couple of decades.
Okay. So Raghu Garu, you have extensively worked with the government of Andhra Pradesh and government of Telangana and conducted breast screening on a large scale. Can you talk about it?
Surely, Shilpa Garu. So basically, the best way to pick up breast cancer early is by way of mammography. It has been proven beyond doubt through several randomized controlled trials spread across several decades that if one has to make a difference and one has to cure breast cancer, we have to pick it up in the early impalpable stage, which can be done by way of mammography, which is an X-ray of the breast, which is done annually from the age of 40. That is the recommendation worldwide. Okay. But in a country like India, where 70% live in rural parts of the country, where they cannot afford to have a mammogram, where there are no facilities to get a mammogram done, we need to find Indian solutions.
Correct.
So in that context, the foundation partnered with the governments of Telangana and Andhra Pradesh, and we trained healthcare workers who are employed with the government to perform clinical breast examination, which is called CBE, which is a way of detecting lumps if they are present in the breast, a professional trained way of picking up lumps. So with a mammogram, you can pick up a lesion as small as 5 millimeters. But if a healthcare worker is able to examine the breast and examine it diligently, she can pick up a lump as small as 2 centimeters. Although 2 centimeters is not as small as 0.5 centimeters, it's the second best way of picking up cancers early, because in our country, because of lack of awareness, absence of a screening program, more than 60% present in the advanced stages, where very few people survive beyond a year or two.
That's right.
So to find an Indian solution to an Indian problem, which is a big problem because breast cancer is the commonest cancer affecting women in our country. So we trained healthcare workers employed with the governments of Telangana and Andhra Pradesh to perform clinical breast examination.
That's brilliant.
And over a 4-year period between 2012 to 2016, we trained over 4,000 healthcare workers across both the states. And these healthcare workers in turn trained, other healthcare workers. So these were the trainers. And then they implemented under the auspices of the foundation, the screening program, clinical breast examination based screening program to women beyond the ages of 35 to 60 to be precise, in 4,000 villages spread across, both the states, and about more than 200,000 underprivileged women underwent screening through this initiative. Those who are found to have cancers were referred to the Arogyasri centers in the neighboring areas, and they were treated free of cost. So this program actually became really impactful, so impactful that I had written to the Prime Minister after this successful implementation of this program, and I was incorporated into the technical advisory group constituted under the auspices of the Union Ministry of Health. And I'm very pleased to say that clinical breast examination based screening program is now part and parcel of the national screening program alongside oral cancer and cervical cancer, which is being implemented through the National Health Mission.
Wow,
So it's a
this
very
is
gratifying.
it is gratifying, and it's a proud moment for all of us also.
Thank you.
Thank you so much for your precious time and shedding so much light on creating awareness about breast cancer. Thank you so much for being on my show.
Thank you.
Raghu.
It's been a pleasure, and it's a privilege to be on your show and through your show to empower people about various breast health issues.
Thank you. I hope this special episode has been an enlightening one. Please share this episode with all the women in your life, as early detection is the most effective in case of breast cancer. See you all next week. Stay tuned for more such episodes. Signing off, Shilpa Reddy.